Hey, Dr. Isaac Jones here, and I want to get into 5 marketing trends for natural doctors that are wanting to really maximize the impact that they have on people's lives and the business systems they implement. The challenge that a lot of doctors have is that they are not capitalizing on these marketing trends. Most doctors, they think of marketing very haphazardly. They don't even have organization oftentimes around their marketing calendars, around the consistency of the things they do to generate revenue. They do their best to put on maybe community events or some kind of random thing that they have in their marketing calendar every few months, but they don't have a machine. What I want is for you to tap into some of these trends that would create a machine-like system for your business that would drive a lot of revenue. And this is not tapping into all these different strategies that other people are talking about right now. Oh, I need to get on this platform and that social media platform and this social media platform. No, we're talking about these simple but easy trends that I'm seeing in the natural health space that doctors are utilizing and getting amazing results with. So I want to get into really what's happening. Why is it trending the way that it's trending? I want to give you some examples of the things that are actually getting created and really what it means for you. Number one is, since our last election, there's been a massive diversification of social media. There's been a huge diversification of various social media platforms. This creates an opportunity to be able to understand who you are speaking to and then niche down on addressing them and connecting with them on the specific platform that they are working in and on. An example could be if you want to engage with entrepreneurs and high performers and investors and people like that, Clubhouse is a great place to engage and develop relationships and DM people and set up meetings. If you want to connect with more of a conservative audience, things like Telegram or Parler or Gab, these are great platforms to be able to connect with more of a conservative audience. If you are looking to engage with more of the younger female population, TikTok is a great place to find those people, as well as Instagram. If you're wanting to connect with more of a 35 to 45-year-old market and female predominantly, Pinterest is a great place to hang out. I love Pinterest, but this is the future. It's diversification of social media. And what we're seeing is doctors are crushing it when they diversify and are creating major growth patterns with special interest groups on these particular platforms. The other thing is that these platforms are giving you massive reach. Whereas if you post something on your business page on Facebook, all the people that have liked your business page, you may get 2% reach versus the 70% reach that you're getting on another social media platform. So this is an opportunity that you have. Authority brands also win. So authority brands are essentially building your brand around you as the authority. There's an ability to create a magnification and attraction factor, leveraging your gifts, talents, and abilities that create likability with the people that are following you. So you end up becoming a magnet to those tribe, that individual tribe, and you can create content and you can create information that's specific to what they want. The old way was be the jack of all trades and the master of none. This is what I see with most doctors' websites, most healthcare professionals out there. They just don't understand this important topic of really becoming an expert in a particular area. And this decreases their ability to create traction. Number 3 trend that we're seeing is the virtualization of healthcare. Healthcare has and will surpass the energy industry as the number 1 money-making industry in the world by 2026. It will be a $26 trillion industry, according to Deep Market Research Group, which wrote the book Longevity Industry 1.0. It will be a massive money-making industry. This is people that are looking for like alternative healthcare. They're looking for functional healthcare. They're looking for anti-aging. They're looking for longevity. They're looking for the opposite of what the traditional medical system ultimately is provided for them. We want you to capitalize on this by going virtual. The way to reach these people and the way to tap into these golden veins that are out there is to virtualize, because you can magnify the ability to target and drive revenue through understanding these things. The other thing is that more patients are seeking virtual care. The demand for virtual healthcare, virtual health programs, virtual health systems, virtual health even recommendations, etc. It's far, far exceeded the supply. Plus of all of the things that we've dealt with, COVID and all of that. So people demand virtual now. But a lot of doctors have not wrapped their head around what it actually takes to go virtual. So the goal is become virtual. And if you want, click the link below to learn more about the Virtual Practice Accelerator, because the Virtual Practice Accelerator is the #1 program in the industry for doctors to go virtual and to position themselves as experts in the industry from a virtual perspective. Number 4 trend is wearable integration. It's the ability for doctors to be able to have hourly, daily, weekly tracking for anxiety, heart rate variability, stress levels, intake of calories, sleep levels, readiness scores, the list goes on, right? It's unbelievable. It's important because the future of healthcare is the customization of healthcare. It is the personalization of healthcare. And that's the community that we've built. Our doctors are committed to being the doctor of the future. People that are personalizing and customizing health programs of the future. So before we saw patient visits and we didn't really collect data, right? But now we have the opportunity to customize health programs by collecting this data and creating an ongoing tweaking and optimization through the quantified self-movement. So number 5 is lifestyle-centered practices. Now, this is my trademarked process of what doctors can do to build a healthy lifestyle around building their business, build residual streams of income online while they live a healthy lifestyle. So the practice works essentially for you. It works for the doctor versus you having to work for the business. It's really designed to create more freedom, to decrease all of the overhead and the challenges that come along with brick and mortar. But it decreases overhead and increases the impact that you're going to have with patients. It's important because your own health and lifestyle no longer need to be sacrificed to run a thriving practice. This is what the lifestyle-centered practice is all about. Before, doctors were forced to take insurance and operate in a $1 billion+ hospital system, and they're pushing numbers and they're trying to hit certain goals. Now, you don't need to compromise your health to help other people get healthy. This is possible because of technology. Moore's Law makes it possible 10 years ago to build out an e-commerce site. It would be $10 million. Now is $297 a month on some of these e-commerce sites. The microchip used to fill up an entire room, a computer, right? And now it fits in the size of like your pinky finger in your phone. It's 1 billion times stronger and more powerful than what fit inside of a room in the 1980s. So, I mean, it is absolutely remarkable where we've come from. So again, I want you to get more systematized. I want you to take action on your building your brighter future and creating momentum around marketing. Consider the diversification of social media platforms as a possibility to capitalize on growth. Become an authority brand because authority brands win. Tap into the virtualization of healthcare and tap into this $27 trillion industry that is forming right now. Start to really tap into the wearable integration, what we teach in Health Experts Alliance and how we systematize things, and also create a lifestyle-centered practice that really works for you versus you working for it. I hope this adds a lot of value to you. I look forward to adding more value to you in the near future. Thank you so much.